Aspirin, also known as acetylsalicylic acid, is a widely used medication with various therapeutic effects. Here's an overview of why it's used, its usage, benefits, side effects, and how to use it. Why it's used. Number 1. Pain relief. It's commonly used to relieve minor aches and pains, such as headaches, toothaches, menstrual cramps, and muscle aches. Number 2. Fever reduction. Aspirin can help reduce fever by acting on the hypothalamus, the part of the brain that regulates body temperature. Number 3. Anti-inflammatory. Aspirin has anti-inflammatory properties, which means it can reduce inflammation and swelling. This makes it effective in conditions such as arthritis, sprains, and strains. Number 4. Heart health. Low doses of aspirin are sometimes recommended to reduce the risk of heart attack and stroke in people at high risk, particularly those with cardiovascular diseases. It works by inhibiting the formation of blood clots, which can lead to heart attacks and strokes. Number 5. Prevention of blood clots. Aspirin is also used to prevent blood clots from forming in conditions such as atrial fibrillation, where irregular heartbeats can increase the risk of clot formation. Number 6. Prevention of colorectal cancer. Some studies suggest that regular aspirin use may reduce the risk of colorectal cancer, although this is still a subject of ongoing research. Number 7. Treatment of Kawasaki disease. Aspirin is part of the treatment regimen for Kawasaki disease, an illness that mainly affects children and causes inflammation in blood vessels. Number 8. Preeclampsia prevention. In pregnant women at high risk for preeclampsia, a condition characterized by high blood pressure and potential organ damage, low-dose aspirin therapy may be recommended to reduce the risk of complications. Number 9. Migraine treatment. Aspirin, particularly in combination with other medications such as caffeine, is sometimes used to treat acute migraine attacks by alleviating pain and reducing inflammation. Number 10. Alleviation of chest pain. Aspirin is often administered during suspected heart attacks to help reduce chest pain and prevent further clot formation in the coronary arteries. However, it's important to use aspirin responsibly and under medical guidance, as it can have side effects and interact with other medications. Long-term or high-dose use of aspirin can increase the risk of gastrointestinal bleeding and other complications. Benefits. Cost-effective. Aspirin is widely available and relatively inexpensive compared to some other medications. Side effects. While aspirin offers many benefits, it's essential to be aware of potential side effects and risks associated with its use. Common side effects of aspirin include: Number 1. Gastrointestinal irritation. Aspirin can irritate the lining of the stomach and increase the risk of gastrointestinal problems such as gastritis, ulcers, and gastrointestinal bleeding. Number 2. Increased bleeding risk. Aspirin inhibits blood clotting, which can lead to an increased risk of bleeding, particularly in the stomach and intestines. This risk is higher in individuals with a history of bleeding disorders or those taking anticoagulant medications. Number 3. Allergic reactions. Some individuals may experience allergic reactions to aspirin, ranging from mild symptoms such as skin rash and itching to severe reactions such as difficulty breathing and anaphylaxis. Number 4. Asthma exacerbation. Aspirin sensitivity can trigger asthma attacks or worsen asthma symptoms in some individuals, leading to wheezing, shortness of breath, and chest tightness. Number 5. Ray's syndrome. Aspirin use in children and teenagers with viral infections like chickenpox or flu has been associated with Ray's syndrome, a rare but serious condition characterized by liver and brain inflammation. Number 6. Kidney function. Long-term aspirin use may impair kidney function and increase the risk of kidney damage or kidney failure, particularly in individuals with pre-existing kidney disease. Number 7. Tinnitus, ringing in the ears. Aspirin may cause or exacerbate tinnitus, a ringing or buzzing sensation in the ears, especially at high doses or with prolonged use. Number 8. Liver toxicity. In rare cases, aspirin can cause liver toxicity or liver damage, particularly with high doses or in individuals with pre-existing liver conditions. Number 9. Interactions with other medications. Aspirin can interact with various medications, including blood thinners, nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and certain herbal supplements, potentially increasing the risk of side effects or reducing the effectiveness of other medications. Number 10. Gout flare-ups. In some individuals, aspirin use may trigger gout attacks or exacerbate symptoms of gout, a form of arthritis caused by the buildup of uric acid crystals in the joints. It's important to use aspirin as directed by a healthcare professional and to be aware of these potential side effects. Individuals with certain medical conditions or who are taking other medications should consult their healthcare provider before using aspirin. How to use. When using aspirin, it's important to follow these guidelines for safe and effective use. Number 1. Dosage. Take aspirin exactly as directed by your healthcare provider or as indicated on the label. The appropriate dosage depends on the reason for use, your age, medical history, and other factors. Do not exceed the recommended dose without consulting a healthcare professional. Number 2. Formulation. Aspirin is available in various formulations, including tablets, chewable tablets, enteric-coated tablets, and dissolvable powders. Follow the specific instructions for the formulation you are using. Number 3. Administration. Swallow aspirin tablets whole with a full glass of water unless otherwise directed. Do not crush, chew, or break enteric-coated or extended-release tablets unless instructed to do so by your healthcare provider. Number 4. Timing. Take aspirin with food or immediately after eating to help reduce the risk of stomach upset and gastrointestinal irritation. If you are taking aspirin for heart health or stroke prevention, your healthcare provider may recommend taking it at the same time each day to maintain consistent blood levels. Number 5. Duration. Use aspirin for the shortest duration necessary to relieve symptoms or achieve the desired therapeutic effect. Do not use aspirin for more than a few days for pain relief without consulting a healthcare professional. Long-term use of aspirin should be done under medical supervision. Number 6. Combination therapy. If you are taking aspirin along with other medications, vitamins, or supplements, inform your healthcare provider to avoid potential interactions or adverse effects. Number 7. Avoid alcohol. Limit or avoid alcohol consumption while taking aspirin, as it can increase the risk of gastrointestinal bleeding and other side effects. Number 8. Storage. Store aspirin in a cool, dry place away from moisture and heat. Keep it out of reach of children and pets. Number 9. Discontinue use. If you experience any adverse effects or allergic reactions while taking aspirin, stop using it immediately and seek medical attention. Number 10. Consultation. Always consult your healthcare provider before starting or stopping aspirin therapy, especially if you have any underlying medical conditions, are pregnant or breastfeeding, or are taking other medications. By following these guidelines, you can use aspirin safely and effectively to manage pain, reduce fever, prevent blood clots, and address other medical conditions. Thanks for watching the video. Don't forget to subscribe to our channel for more health tips and information.